Coming to the May meeting of the Health System Board of Trustees. We do have a quorum as present, and I also want to remind everyone that you are having your 15 minutes of fame being recorded on YouTube. So be careful how you want to use that time. Thank you. Hopefully you've had a chance to review the minutes of the previous board meeting from April. I would like now to have a motion to approve the minutes of the April 16th, 2025 Board of Trustees meeting.
Second.
Thank you. All in favor, say aye. Aye. Any opposed? Any abstentions? All right, the minutes are approved. Now, as always, is our passion, as is our goal, we will have a mission moment. You want to say anything before this?
Sure, of course I do. So this is, I'm really excited to see this video today. This is something that Stephanie worked on. There was an art show that is part of the peer-to-peer program. So this is at Richmond Heights, and it's a collaboration between our school health program and a family who funded this, who lost their child to a brain disorder, a mental health disorder. And so this program is really meant to bring awareness of mental health issues to the teen population specifically. And we know this from the school health program that teens are really struggling with depression, anxiety, suicidality. We see a lot of it in school health. And so that led to the development of Students Are Free to Express using the arts, which led to this program, peer-to-peer, trying to destigmatize mental health concerns. And this was such a beautiful event. The artwork, and it was art and it was music and movement and all of that, but the students also shared their story behind the piece of art, and one story was more impactful than the other. It truly was an incredible event. So with that, I will turn it over to the team.
Okay. Question 2. Which of these is a sign of depression? Check all of them that apply.
Us being kids just growing up, there's a lot of things that kids are thinking that a lot of people don't know about. And I think it's important being in this group just to try to help.
People like to look outside, but the biggest problem can be inside. So knowing what to do, how to do it, knowing you're not the problem. And even if there is a problem, it can be fixed no matter how long it takes.
P2P is a youth-led mental health awareness campaign. So the way that looks is that we have a group of students. They are actually the ones that design and implement the mental health awareness campaign for their peers. Really, we take their ideas, their vision for how are they going to build awareness around mental health in their peers, along with the other goals of the program. So the goals of P2P are to raise awareness, reduce stigma, and encourage help seeking.
In my life, I know someone that committed suicide, and I just wanted to be the person that made somewhat of a difference.
A lot of my friends at first thought that talking about stuff like this is maybe a sign of weakness, but I've talked to them, I've told them about other people dealing with similar situations. We can all just relate to it, and it just opens ourselves up to better possibilities for getting help.
I want everybody to just paint what they feel.
One of their campaign ideas was to do an art show focused on mental health. When you look at their art piece and you read that script, you see that there's so much intentionality and so much such a personal touch.
This event, we dare to journey out loud and end the stigma. You all coming out to support the peer-to-peer program and these amazing artists is another way we journey out loud together.
One of my best friends was struggling, going through it, and she called me, trusted me to help her with whatever she was going through at the time. And so I feel like everything that I learned, it just came into play that night. And to know that at the end of the night, I made her feel better, stop crying. It made me feel really good about myself. I really learned that here.
Like before the P2P and this whole program, mental health really wasn't a thing at our school. A lot of people wouldn't talk about it. Now we go around, we can all talk about it. It's better understood. Even down in the middle school, they have started their own program So it's really just like a whole snowball effect that's happening.
Just the fact that they've been able to take this information and their experience and translate it into how I can show up for my friends, that says a lot about, you know, the impact that we've had on our members and now the impact that they have on their peers.
Very impressive. Good to hear about the many good things that are going on in the community that we're a part of. We talk about some of the things that are more challenging, but thank you, team. Work very well done. Okay, I think we're now ready to hear our committee reports, and we'll start with the Population and Community Health Committee. Ms. Mendez.
Good afternoon, everyone. If I could just take 2 quick minutes, because I promised someone from the community that I would share this with the board. She's an executive director of a nonprofit locally. She has a son who's nonverbal in a wheelchair, who's an adult. She noticed that he just wasn't the same. He wasn't eating, but again, it was hard for her to understand what's going on because he's nonverbal. So ultimately, her and her husband did bring him to the ER at Metro. She said that the team quickly figured out that there was something very serious with her son and that she was crying when she was telling me the story, how grateful she was to the whole team in the ER here, that they not only explained everything to her and her husband, but they explained everything to her son and made him feel cared for and that he was a human being. And it's not always the case. She had to stay in the emergency room for a while because they had to find a room. And she said she gained so much respect for what everyone had to do and how many people, how much trauma, everything that was going on. She said we could hear it all. So she just wanted me to share this with all of you, how grateful she was and how grateful she was for the way you treated her son. And so often we do hear the negative, and I just felt it was important for you all to hear the positive, and please take that back to the ER team, that there's one parent, one family, and one man that is so grateful for the way you treated him. Thank you. So not so exciting, population and community health. We met April 30th. And this was really just a re-kickoff of this committee. So we just really spent a lot of time on introductions because we invited a lot of new members and we wanted to get to know each other and what our strengths and expertise was as we embark on this work. We also looked at changing the name. So as you see, we are now Population and Community Health Committee. We really want to be more intentional in terms of having clear outcomes, goals that are measurable, that will achieve certain goals. We are still very much committed to serving everyone, no matter what, throughout our region. That is still at the core of who we are, but we just want to be more intentional and be able to measure on how we get there and what is our impact. We are also beginning to work on the charter, but we're not ready to present that yet. That will be coming at a later meeting, but we have begun work on also redefining the charter. So that's about it for that meeting. Any questions?
Thank you, and I appreciate the effort of working that community a little bit. I know it's a big charge we've given you to try to serve all our mission and still make everyone understand what we're trying to do and what we're not trying to do. So I appreciate the community's efforts. Thank you. All right, quality, safety, and experience, Mr. Ron D.
So we met today from 11 to 1. Started our story off with a patient experience story of a 72-year-old male that was involved in a house fire, ended up being burned, and talked about the care he received within the burn unit and the comprehensive care he received post-burn, and how he's improved and how he's recovered from that burn, and how thankful he is for the services he received here at Metro. We then heard from M. Sullivan regarding patient experience scores, both inpatient and outpatient, and the efforts being made to improve the HCAHPS scores across the health system. Then switched to nursing annual quality review. Dr. Morey presented information regarding how they're using evidence-based approaches to and leverage approach to improve patient care, quality of care, reduction of harm, and improve nurse sensitive indicators across the health system. Then went into executive session for legal update and some other reviews, came out of executive session and
Completed the meeting. Any questions, comments? Chairman, and we'll now move on to the Finance Committee, Mr. Moss.
Mr. Chair, the Investment and Finance Committee met today, Wednesday, May 28th at 1 p.m. First, we had ClearStead up. They first broke down our investments. There's non-reserves, that's stocks and bonds, representing about 210 million. Then we have reserve, which is basically mostly cash, 318 million. Then we have captive at 110 million, which represents our insurance. Both the non-reserve and reserve, the market's ups and down, up about 1.5%. We then had Derek Hollings give us a presentation on the financials for April and for the year. Last time we met was February, so I'll focus on the year. Through April, we were up, our EBITDA was 28.4 million, which is 11 million below budget, but about 7.4 million above last year. We had increase in pharmacy of 24 million over last year and expenses in pharmacy of 16 million over last year, which basically makes the difference. At the time, all numbers are up, all volumes pretty much everywhere over last year. Maybe the weakness being still the behavioral health center in Cleveland Heights. We had a discussion about the balance sheet, assets of about 2.8 billion. And then the payer mix to date is the commercial represents 28.5, which is up a little bit from 26.4 the year before. Medicare has stayed steady at 36%. Medicaid has dropped from 32 to 29, and self-pay has increased from 5 to 5.7 from 4.9%. And this is pretty much the trend over the last number of years. Cash on hand, we're at 117 days. Although that meets our bond covenants, that's down from 125 days prior year. And if we go back to 2019, we had 154 days. We have approximately 635 million cash on hand versus 665 million at the end of 2024. We then had a discussion on uncompensated care discussion, both in public and then, sorry. Chair, that's my report. Any questions?
Hearing none, thank you, Chairman Moss. All right, now it's time for our President CEO for her report. She has a good report in your package, but let's give her an opportunity if she has any additional comments.
So I'm going to highlight some of the things in the report in the event you didn't get to review that in detail. First off, just a lot of gratitude to the board. For the first time in quite a while, we have all 10 positions filled. And so I feel like that is really such a tribute to the board members that are here and serving as great role models to Chris Ronayne and the county team, but also the institution that people want to come and serve. So many, many thanks to all the board members, and especially excited at the recent reappointment of Dr. Walker. So thank you for all that you do. When I go to meetings and speak with other CEOs and senior leaders, I hear a lot of griping about their board members. And I feel like, wow, I'm really blessed. Like any question I have a board member with expertise in that area that I feel like I can go to, and they are open and helpful. So feeling very, very blessed and grateful. Some other things to be grateful for. You heard already about the success in the emergency room with improving the patient scores, the patient satisfaction scores. So I won't belabor those points. We recently hosted a mass casualty training event. And really so proud of our team. Gigi Hubbard led the team, but collaborated with lots of stakeholders across the institution and outside the institution. And the phrase that we were using is, you know, when you fail to prepare, you prepare to fail. And so I think this was a great example of coming together with our community to say, how can we ensure that we are going to be the best prepared if the unthinkable actually happens? And we were able to use the old towers for even movement of patients and how to move folks if you need to redeploy, et cetera, et cetera. We've had some very successful community events. Councilwoman Meredith Turner hosted an event educating women on fibroids, and she shared very openly her journey, as well as Congresswoman Brown shared her journey. Dr. Schreiber was there. She is one of our OBGYNs. It was quite an event. We were scheduled to end at 7 o'clock, but the women who came that were sharing so in depth till 9 p.m. They were so engaged and so grateful that we were there to just open up this discussion. So we're planning more events like that. I also had a wonderful meeting. It didn't get included in your packet, but with our pastoral council that is made up of pastors of the local churches. And that to me was just an incredibly emotional event, just feeling their support and that connection to them. And at the end, and artists, is he here? No, he was there representing his church as well. So it was wonderful to see someone I really knew. And at the end, one of the pastors did a special blessing over me, which was just incredible. Like, and I have since gotten multiple notes from people that were at that event. So just very moving. Do you want to shine a light on the hospice conference that I spoke at their board meeting, and we were able to honor Dr. Connors, the one and only, the man, the myth, the legend. But just also to call out, we all hope to do well by our patients and to change medicine, and Dr. Connors actually did that. Dr. Connors did the landmark study that now dictates improving care at the end of life, which has led to the growth of hospice and palliative care and has improved the ending of people's lives. And so they recognized him and just wanted to give him that shout out. And I will also do a shout out to our team members that were interim leaders that are now permanent in their positions, Doug Bruce, David Stepnick, Candy Mori, that are now permanently named into their executive roles. So congratulations and thank you for your hard work. And then just the update on the travels between DC and Columbus, really trying to advocate for our patients and educate our legislators on what it means, to make cuts to Medicaid. What's the real impact to real people and in the community? And while we don't know where that will all land, we have some sense, right? We're I think Kinsey said we're at halftime, so we have some sense of where some people are. What I do know is we have a wonderful government relations team. We've had some very positive meetings, and at least we know that we are doing our part to represent our patients and community. So I will close it there.
Question for Dr. Alexander. Thank you, Dr. Alexander. Dr. Joseph? Right on time as usual. So you present the medical staff report. Thank you.
Thank you. You should have received in your packets our medical staff newsletter as well as the recent reappointments. Just to highlight a few items from the newsletter. We did back in April have a Doctor's Day celebration. It was a great evening of getting our staff together. We had speakers, including our own Dr. Bob Smith, and really with speakers that centered around resilience and moving forward during challenging times or times of change. It was well received, and I think a good for everyone. We currently have our MEC at large elections going on. I think the nominations will close May 30th, and so by the beginning of next month, we will appoint an at-large member of our medical staff to the MEC. We're in the midst, actively in the midst of a bylaws review, and it will be sent out to the medical staff in early June, hopefully so that we can vote on it at the MEC by the end of the summertime and can present those changes to you here at the board at the end of the summer. We also, our nominations for the Medical Hall of Honor closed on April 15. We currently have 13 nominees, two of whom I believe will be legacy candidates, and we're beginning the selection process. Hopefully that will end by the end of July with a planned ceremony in November. So there'll be more to come about that. And then lastly, a number of our faculty were recognized by the Case Western Faculty Senate as being participants in our recent medical school graduation, and I think included our own Dr. Stepnick, Dr. J, I think were part of that. And so they were recognized for the accomplishments and involvement of our staff. And then lastly, I'd just like to seek approval for the minutes of the Credentials Committee. That was from the April 29 Credentials Committee, and that was recently accepted by the MEC on May 9th. And these are the appointments, reappointments, and actions from those meetings. So can I seek a motion to approve those?
So we need a motion to approve the medical staff revised appointments, action reappointments for March and April 2025, along with the acceptance of the MEC minutes of March 14th, 2025, and April 11th.
So moved.
Second.
Thank you. All in favor? Aye. Any opposed? Any abstentions? Thank you all.
Thank you.
Thank you, Dr. Joseph. At this time, I think we're going to move to executive session to discuss hospital trade secrets as defined by ORC 1333.61 and consider the appointment, employment, dismissal, discipline, promotion, demotion, or compensation of a public employee or the investigation of charges or complaints against a public official, and to conference with the public body's attorney, discuss disputes involving the public body that are subject to pending or imminent court action as defined by ORC 12.1.22G. Can I have a motion?
So moved.
Second?
Second.
All right, we'll do this by roll call. I believe we said Mr. Arnold's not here. All right. Mr. Corlett?
Yes.
Ms. Dumas?
Yes.
Mr. D?
Yes.
Ms. Garcia's not here.
She's here. She just jumped.
Oh, hi, sorry. All right, we're moving into executive session if you care to vote for that. I'll give you some time to think about that.
She's trying to get off mute.
Okay. Mr. Jacobs?
Yes.
Ms. Mendez?
Yes.
Mr. Moss?
Yes.
Mr. Summers?
Yes.
And I vote yes. Are you okay? Noah, can you hear us?
Lola.
Lola, can you hear us? Doesn't sound like she can. Okay, well, I think we'll go with the majority here. We'll get back to that. So we will now move into executive session. Well, you can be an expert on who's here or not.
We ask all members of management to step out, except for members of the executive leadership team.
Do you need? Okay.
He's pretty studious.
Well, we're gonna talk about the financial assistance policy. It'll just be brief. I'm not gonna rehash the whole.
Well, he dropped. He
Okay,
just dropped.
that's fine. We can.
Okay, we're good.
Are we good?
We are good.
That's good. We're now in executive session. Ron's trying to make me crack up laughing here, but I refuse to.
You did laugh. You did
I
laugh.
will not take the bait. Okay. We have. Okay. All right, we're back in public session. Again, I want to thank everybody for the great presentations and discussions we had, both in the general session and in the executive session. The one thing that stands out in all of our discussions that everyone here is totally committed to the mission of mental health and will continue to be that way. And I'm glad to hear that. And with that, unless there's any other discussions, we are adjourned.
Great meeting.